Thank you very much, Sean, and thank you everybody for the opportunity to present at the DigitalEd Conference today. This presentation is titled Creating a Reusable Learning Object to Support and Educate Patients Pre and Post-Surgery. The project is a partnership between the Blackrock Health Galway Clinic and the Atlantic Technological University. And the main project partners, if you like, are Marguerite Duggan, who I'm not sure is with us today, Kevin Cunningham, who is on the line, and myself. So this project was initiated, if you just bear with me. This project was initiated through a nurse in the Galway Clinic initially, and the surgery that we're talking about today is radical prostatectomy. And the reason why we were interested in this surgery is because we had a nurse clinical specialist who was working on one of our programs in the ATU doing a master's in quality and safety. So just a bit of background about radical prostatectomy. It's one of the treatment options recommended for patients diagnosed with localized prostate cancer. And robotic assisted radical prostatectomy, which is abbreviated RARP, is now widely accepted as the gold standard for this type of surgery by urologists. So this opportunity was identified as an area for improvement in the Galway Clinic in late 2020. And the opportunity was around improving education and support for patients that needed to undergo this robotic surgery. The Galway Clinic has been a leader in this field of robotic-assisted radical prostatectomy in Ireland since 2007. And on average, the Galway Clinic has carried out 169 of these procedures each year over the last 5 years. So just in terms of the background then, this was framed under a student's master's project. And the idea was to introduce a pre-admission information and support service for patients in the Galway Clinic that were going to undergo robotic-assisted surgery. And the idea, as this was during COVID-19, was to use a virtual platform or a virtual health approach and to complete this project within a 3-month time frame. So there were a number of intervention tools created as part of the initial project, which were an education package, if you like, in a PowerPoint presentation for patients. Certain patients were selected and recruited for this study. They were referred by their treating urology consultants when they were scheduled for surgery, and there was consent and etc. Organized. The virtual platform was selected using Zoom, and patients were invited to attend an online virtual information and support session, which was created virtually by the clinical nurse specialist, who is, I'm not sure if she's on the line, but our colleague in the Galway Clinic, excellent nurse Marguerite Duggan, who implemented this service, which didn't exist at the time. So the idea was that patients would attend this virtual information and support session, and then they would feedback on whether they felt suitably prepared for their surgery. And heretofore, before this kind of education didn't exist. Patients would go in to see their consultant, and their consultant would obviously give their diagnosis and would inform them that they needed surgery. But this surgery involves some specific pre-op and post-op care, and patients weren't actually getting this information at the time. So this was framed as an improvement activity initially to evaluate patients' experiences of using this virtual healthcare information, education and support session. So there were a number of patients referred to the study, and the measure was what percentage of patients took up the offer for this support session and what percentage of patients declined this service. So loosely, it was framed as an improvement project to improve the service that was offered in the Galway Clinic. The outcomes then of that project were that 32 patients were referred, 27 phone calls were made to try and recruit patients, only 20 agreed to take part, 1 dropped out, 6 declined, 5 were not contacted, 1 surgery changed, and overall 19 support sessions were conducted and then followed up with a questionnaire to the patients. And the outcome of this was an overall positive response from patients and staff in the Galway Clinic. particularly patients, and one particular patient said, I only realized afterwards, looking back, that the information he was given online by the nurse, how useful and how beneficial it was. And as scenarios presented themselves before, during, and after his surgery, he remembered what he was told in the information and support session. So the outcomes were very good. The conclusions then from that part of this project were that during COVID-19, obviously it was beneficial that patients didn't have to attend an appointment for education and support. It reduced the need for patients to travel, and it offered patients the choice to have a family member present. The challenges were sustainability. So this was the idea of Marguerite Duggan, one particular nurse in the Galway clinic. And to do this, she needed to frame the entire work herself, contact patients, explain the call to them, arrange the call, send out the link, provide the education, etc. And this was done on top of an already existing nurse service. So this wasn't part of the service at the time. So there was no allocated resource to undertake this work, and therefore, for a longer-term approach to an improvement in care, it was going to become problematic. And at this stage, it was identified that there could be an opportunity to develop reusable learning objects, and that is the focus of where this project is at now. And the reusable learning objects could be then offered to the patients so that it didn't require a nurse resource to teach the patients and to inform them and support them. So the current project, that's the background, is that the ATU Mayo campus and the Blackrock Health Galway Clinic applied for and were awarded funding under the Pilot project for integration of research and teaching. The idea being that we could look at researching and evaluating the level of information and support given to patients and whether it improved their experience and outcomes, and how the teaching approach of this education and support could be used for patients, but also perhaps for undergraduate nurses and for other specialities to show them how to inform patients about their care. So a project was framed, a service improvement project to develop and sustain information and support for patients undergoing robotic-assisted radical prostatectomy using reusable learning objects. And the 4 pillars of this project were to produce professional interdisciplinary education, information and support videos for reuse, to produce animation videos on the practical aspects of self-care. So when a patient has this surgery, some of the aspects of their care would be wound management. This is a robotic surgery, so they would have 4 wounds in their abdomen from the robot. And they would also have to have a urinary catheter after their surgery, and they would have to give themselves injections. So some of these post-operative aspects of care were very important to educate the patient. So we looked at how we could produce animation videos on the practical aspects of the self-management, because following surgery, patients are discharged on day 1 or day 2, and they have to self-manage their post-operative care. We want to consider patient use and preference in all the aspects of the design of this project. So we wanted to include a patient, but then also to test the RLOs with a patient and to see whether they found them beneficial. And then with the first 3, we wanted to wrap all this up and develop this into a reusable learning program for patients undergoing RAP, so that instead of using a nurse resource that would have to call and follow up with every patient, patients could actually access the reusable learning objects on a website or on a platform, and then they could undergo the education themselves without a nurse present. So Kevin Cunningham was kindly allocated from the Teaching and Learning Office to participate in this project, and Kevin has been involved in the design decisions and the teaching and learning aspects of it. And Kevin, you might take over for the next few slides.
Yeah, thanks, Richard. So yeah, just in terms of I came to the project obviously more or less where Richard has left us in terms of explaining during this PowerPoint. So, you know, a lot of the work had been done of what has happened previously, you know, doing it via Zoom, doing it via one-to-one, but I was coming on board to obviously try help that create that reusable learning object. So obviously key parts of it there, like Richard has here on the slides, is that staff from all different aspects the patient's journey. So everything from the consultant to nurses to theatre nurses, physios, everybody was involved in some shape or form to help create a learning object that'll be reusable and that'll be beneficial for the patient. So we also involved the patient just to get some endorsement. So that patient obviously would have been through it via meeting with Marguerite and going through the PowerPoint like Richard explained. But the same sort of information obviously is in our reusable learning object that we've been creating. So that endorsement is obviously a positive one to have. You know, we made sure that the experts are delivering like the key information, and then in terms of our job was putting that into a simple kind of accessible format, just given that, you know, the typical kind of patients here are potentially, you know, older men, and obviously we don't necessarily know how tech savvy anyone is, so we don't want to be putting anyone off by making it too difficult to access or, you know, work your way through it. So that was a really key kind of consideration of ours. So as part of that, we just you know, started developing it. We created a timeline. We started getting things in motion, and we went about organizing, you know, getting the likes of the nurses and consultants, and which wasn't easy, obviously, because they've got busy schedules, but trying to get them in to record a video and so on, and get all that kind of content so that we can then work with it. So then we got a lot of that stuff done, and we started developing the RLO, and from there we've also developed animations. So as you can see here in the timeline, it's a multiple project team, as in, you know, you've got people from the Galway Clinic or the Blackrock Health Clinic, as now they're known, the Galway campus of that. We started developing it in October. We shot the videos in December. We recently got the animations created, which have just been delivered and completed to us just at the end of April there. So they're now ready to be uploaded onto the actual Articulate piece of platform, which will be the reusable learning object. And then from there, you know, we just need to go on now and refine and make sure everything is how we want it to be on there, and it looks how we want it, and it you know, navigation and all that kind of stuff is how we want it to be. Once that is complete, we'll pilot it a little bit, even internally, you know, in terms of some people that we know, just to see what they think of it. And then once we're definitely happy with that, it'll be piloted with actual patients and evaluated as a result, much like what was done previously with the one-to-one version, which was done via Zoom and PowerPoint. So yeah.
Okay, thanks, Kevin. So we've used a combination approach initially with the quality improvement methodology to try and implement change and test change. The output of that, obviously, was that the change had led to an improvement. So the introduction of the intervention via Zoom, and patients fed back that was an improvement. Now, this is kind of morphing into an action design research approach, where the evolution of the product is going to be concurrently built and evaluated. And we've been doing that in various iterations back and forth between the project team. And in nursing and healthcare, particularly, practice development is a process of improvement, which looks to increase effectiveness and person-centered care. And the Galway Clinic has a very focused approach on practice development and person-centered cultures. And this kind of project aligns with those designs and philosophies. So it's an evolving program and project and an evolving design at the same time. So we are going to show you some of the RLOs. So one of the first things that we did was we recorded professional explanatory videos. So a series of professional videos were created to explain the important aspects of robotic assisted surgery. So a video production team went to the Galway Clinic Blackrock Health for the day. and some clinical staff gave up their time, including doctors, clinical nurse specialists, physiotherapists, and they did a 12 or a 14-hour photo shoot and video shoot in order to capture the clinical expertise in what we now have as reusable learning objects, which we are hoping to embed in an overall package, but also can be used as standalone explanatory videos for certain aspects of the procedure. The second thing that was done was professional animations, as Kevin said, which have just been delivered. And these involved clinical experts, confirmed the text and the images for these animations. So Marguerite from the Galway Clinic was heavily involved in this, making sure that the clinical aspects of the care were precise and that the animator understood exactly what needed to be to come across in the animation, so that these products could be actually reused as and when needed. And some of the animations that we have are around these really important aspects of care for a patient, around urinary catheterization and catheter care after the surgery. And some patients would be very unfamiliar and unaware of that, even going into their surgery, that they would actually need a catheter, and they would have that catheter for some time after their surgery. They would need to give themselves an injection, and they would need to care for their own wounds. So we thought the animations really would meet these requirements and make it very explicit what the patient self-care tasks were. So we're going to try and show you some of these, which will take about two and a half minutes of the video examples that we're going to give you. And then Kevin is going to go through, for the last part of this presentation, the actual overall package which we've created in Articulate.
Hello. If you or your loved one have been diagnosed with prostate cancer and are considering having a robotic prostatectomy, our aim is to provide you with the most up-to-date information that will better prepare you and your loved ones before, during and after this surgery. We do suggest that when you first look at this video, you should view it in its entirety. You can then choose a topic or section that you would like to look over again. There are further links to information on related topics that you may choose to explore further by simply clicking on the link, and you will be directed to this information. If you have any queries or concerns, get in touch with us by clicking on Contact to send us a message.
So in terms of this video, what we thought was important was to really get a sense of the patient's meeting or having the voice of some of the staff that might be caring for them, and getting an introduction to the RLOs in that way, and explaining it out in a video would be much better. So this is really just an introductory video. We're going to show you one of the more explanatory videos about the procedure in some time. So this video would introduce the overall package. So I'm going to show you an animation now, followed by a second one, which take about 2 minutes. These are quite explicit in terms of urinary catheter care, but remember the focus here is on producing very accessible and easy to understand packages of support for self-management, so that the patient can absolutely understand what they have to do. And if you recall from the start of this presentation, they weren't getting this information in this format until Marguerite started to meet with them online, which we know now is not a sustainable approach. So I'll show you this animation.
What is a urinary catheter? A urinary catheter is a thin, soft, flexible tube that drains urine from your bladder into a collection bag. It is held in place by a small water-filled balloon. This balloon prevents the catheter from falling out. The catheter is inserted into your bladder during surgery. It is left in place for 7 to 10 days until you return for an outpatient's appointment for catheter removal. After your surgery, you may feel the need to pass urine. This sensation is caused because the catheter is keeping a valve open in your bladder that is normally shut. This sensation should pass. For the first 24 hours after surgery, you will have a 2-litre urine collection bag attached to your catheter. Your care team will monitor your urine output during this recovery period. A day after your surgery, this bag will be changed to a smaller leg bag, also called a day bag.
Okay, so you can see from the animations, it's very clear then the information in terms of what a catheter is, where a catheter goes, and what its purpose is, which is very important for patients to understand that prior to their surgery. This is the second one, which is just about 1 minute, and then Kevin, for the final piece, is just going to go over the overall view of the package.
Collection bags. You'll be given 2 types of urine collection bags: a leg or day bag and a night bag. Day bag. The day bag is for use during the day, attached to the leg. It is discreetly secured to your leg under your trousers with elastic straps. This bag allows you to move around freely. You will need to empty this bag regularly, when it is approaching half full or when it begins to feel heavy. Night bag. The night bag is for use at night. The night bag attaches to your day bag to allow for extra drainage. This extra drainage space means you don't have to empty either bag until the morning time. Your catheter drains by gravity. Always make sure that your collection bag is below your waist level, so the urine drains downwards. Your night bag can be placed on a catheter stand, a hook onto your bed, or be placed into a clean container. Do not allow the bag to touch the floor for hygiene reasons.
Okay, so Kevin, I'm going to move back to you. You've got about 5 minutes, I'd say, just to go through the Articulate package. So I'm going to hand over to Kevin, and I'm going to load the link here, which should show on my screen.
Perfect. Yeah, so just to explain, this will be the overall package, and basically this kind of where the black outline is there for that window, that will essentially be hosted on the Blackrock Health Clinic website. A couple of things I suppose to note, you might have seen previously some of our videos which we filmed earlier. They just have older placeholder images such as GMIT and so on, whereas our animation were completed post the whole ATU branding. So we do still have a couple of edits to do with regards to our videos, but that's all part of this final process. Well, just to explain, this is kind of the look and feel of how the course would be. So this is just literally the introductory kind of first slide that a patient might see. And on the sidebar where the menu is, a patient can either simply click next on the bottom right, or simply select a particular section that they may want to revisit. And I suppose when you think about yourself as a patient and visiting a doctor, whether it's for a procedure or for just generally a checkup or whatever it might be, as these patients would have done, they heard that information once in one session, and it might be a 10-minute session, and it might be very difficult to remember everything in detail what the health professional has told you. So this reusable learning object, as kind of mentioned previously, is really good for before, during, or indeed after the whole procedure. So if we just change as well there to, let's say, the what is RARP slide, this kind of give you an idea of what a video might look like on this package. So this video is from the consultant. Basically, the patient can play it, and the consultant from the Galway clinic, the Blackrock Health Galway clinic, explains what the procedure is. And then there are a couple of other sections which obviously the patient can go through, such as, let's say, advantages of RARP. And on that slide again here is just, it's another video. But for some of these slides where it's kind of covering key information, But what we've done is also added a recap slide. Now, you might think, oh, you might necessarily need that, but what it does is, in terms of accessibility and making sure that people can take in the content and choose how to take in the content, it's just summarizing the key points from the video, which was a purposeful design decision in terms of who the patients are and so on. But also, it's important because, to be fair, this is important information which the patient might want to know and might want to revisit basically at any time. So this is very much the introductory section, but other sections obviously go on to talk about post-surgery and so on, and that's where we go on to include the animations and other videos like that. So that will be really important when it comes to that section of a patient's journey with this kind of procedure. So and that includes physiotherapy, which we've also recorded videos on. So yeah, just to, I suppose, wrap it up there. I suppose we've covered a lot in terms of the background to this and the whole design of it. I think it's a really important kind of reusable learning object that for patients, and the whole model of it could be kind of reused for different kind of procedures and so on going forward, because I think it's actually quite a useful method for communicating this type of information with your patients. So yeah, if you want to add on.
Yeah, okay, thanks, Kevin. So I think that that particular slide is important, showing what the actual package will look like. So the last pieces of this project, if you like, are to put together the RLOs into this articulate package, and then we hope to deploy that in some kind of a link which will be issued to patients from the clinical nurse specialist in the Galway clinic. And then once they have the link, they can go back and forth and access the resource as and when they see fit. One of the other and last points is that because these are RLOs and we've used them in the overall package, but they can be used independently as well, and they will be useful for educating nurses on the undergraduate nursing program, and indeed on showing postgraduate master students how a project can evolve into an intervention can evolve into a really good change and improvement project. Just really last thing to say is the acknowledgements of all the people involved. Really excellent people in the Galway clinic, Blackrock Health, who have allowed this project to take place and have supported it. And thanks to Kevin, the Teaching and Learning Office, and the Pirate Initiative. So we've just got some questions there, Sean. I don't know, we've finished presenting. Do you want us to take the questions? Or?
Yeah, I think that would be great. It looks like a really super resource, folks. But you can see the questions there, Richard, can you, and Kevin?
Yeah. How much did the overall package cost? Good question, Nora. So we received a budget of 10,000, and we have used all of that, I think, Kevin. We've used all of that, split between software, professional videos, and animation videos. So we've used our full budget, but we think we've got everything we need at this stage to produce the final product. Will completion of the e-learning be compulsory for patients or optional? I don't think it will be compulsory. Patients will have the right to not accept it if they don't want to. They will be offered it. They will be given a link. One of the things that was found out in the initial phase of this project was that it was offered, because of the problem with sustainability of one nurse delivering these sessions, it was offered to patients that they could do a group session. But given the nature of this type of surgery, it was some men fed back that they wouldn't be comfortable participating in a group session, and that was one of the things that informed the process of the RLOs as well. So it is felt that the RLOs will be a more palatable package for patients, and it would be likely that they would uptake and use them. How will you evaluate the impact? So at the moment we're working on that between myself, Kevin and Marguerite, on piloting the entire package when it's complete, probably just making sure with people that have been involved in the Galway clinic first as part of the iteration process, and then piloting maybe with new patients, but also allowing patients that received the one-to-one to look at this new package and see how beneficial that would have been if they would have had the options. So it will be a case of using it on patients and then asking them their experiences of it. And we'll have to design, obviously, certain measures for that as we go along.
It'll be kind of, yeah, and I like that, like Richard is saying, it'd be similar enough in terms of methods to what was previously used to give a pretty fair evaluation of it. I kind of refrain from using the word comparison and stuff like that, because it's very difficult to compare when it's a different group of patients and so on. And even with the same patient viewing both, they have experience of seeing it and being through the procedure. So it's just getting a sense of how people think about the actual package and did they find it useful. And to be fair, that will take a bit of time to actually collect. If you think about, they need to see it in advance. The other thing to add is obviously a family member can view it with them and view it at any point, as well as the patient themselves, which kind of hopefully helps with communication around the information around the procedure. And then, once they go through it all, the procedure I'm talking about, then they can give it maybe more, let's say, overall rating and evaluation of it in terms of how they felt the information was helpful from the post-operative kind of information that's included in the package. So, yeah.
Thanks, Kevin. I think Nora's asking some really difficult questions here. Fair play, Nora. Are there any ethical issues? So yes, I had to go to our DPO numerous times back and forth in terms of a data protection agreement was one aspect of it. Who owns the product, who can use the product, etc., etc. So there are some fine details in that I can't remember, Nora, to be perfectly honest, but we did go through those processes. Essentially, this is a shared project for the intention of it being beneficial to patients and to student nurses. So for me, it's envisaged that it will be used in partnership between the Galway Clinic and between the GMIT, the ATU, with both aspects of branding. Public funding go to product for private hospital. Now, the only thing is, in terms of that, is that there are public hospitals that undertake this procedure, but a lot of the procedures for patients are done in the private hospital, and you'd be aware of public-private physicians operating across public and private hospitals. So there's no reason essentially why the product could not be rolled out further if it was successful and shared further. So good question.
Exactly, and even to say that, like the same consultant who does the procedure in Galway does it all in Galway Clinic, does it also in UHG. So, like, I mean, if it's about like evaluating its kind of effectiveness and how patients kind of evaluate the whole package itself, that will dictate like it being rolled out further. I suppose this is
one of the last points as well is that since our colleague Marguerite undertook this work, it hadn't really been done to this extent and with this evaluation in Ireland that we were aware of, and it's since been taken up in the University Hospital in Galway, a version of this by contacting patients and giving them this type of support in virtual health. It was originally some of the information we got was from a study that was done in Australia by some clinical nurse specialists there. So that's about the size of it. I think we're timed, Sean. Sorry.
No, it's fine. I was letting us run a little over because I know they're running a little bit over next door as well. So I thought we're parallel. We may be properly parallel. I think it's a great resource. I think we all talk about the conditions of learning, and I think we'd all agree being told you're about to have an operation for cancer in an office with a nurse is not the greatest condition for learning, for remembering what you need to do 10 days or 5 days after your surgery. I think it's a superb idea that they can go back when they need the information and get it easily accessible. I think it's super.
Yep, thanks, Sean, for the feedback. And we're always wary of a project like this, or I am particularly as a nurse, because the whole DigitalEd conference is not focused on things like this. I don't think they're much more techy and less to do with healthcare. But anyway, thanks for the opportunity to present it.
Okay, no, it's great. It's a really worthwhile project. This is cool.